So let's talk first about the diagnosis of Parkinson's disease. Now, this is a major thing because if you have been diagnosed wrongly with Parkinson's disease, then all your life you are being treated for a diagnosis which was never there. So how to come to this conclusion whether you really have Parkinson's disease or you don't have? And the best approach I would suggest is to see a neurologist who deals with Parkinson's disease. We call them movement disorder specialist or Parkinson's disease specialist. So once your GP thinks or your family doctor thinks that you have got Parkinson's disease, then probably it's a good idea to see a neurologist and get it confirmed. If in your mind you have any doubts, it's good to get a second opinion and see another neurologist who can diagnose you or who can look into the things again. Sometimes it's very hard to diagnose a Parkinson's patients because there are very similar disorders or diseases which looks like Parkinson's disease. It can mimic benign tremors, and sometimes anxiety or depression can look like you have got Parkinson's disease. So it's a very important thing to diagnose it correctly. Once you have been diagnosed, and I should tell you the diagnosis is clinical. There is no blood test, there is no neuroimaging, there is nothing specific about the diagnosis which you can be 100% certain that this is Parkinson's disease. So a clinician, a neurologist who is experienced in diagnosis is the best and only way right now. Now the problem comes once you have been diagnosed with Parkinson's disease, a lot of patients don't accept the diagnosis. And this acceptance to the diagnosis is a big obstacle in your recovery program. Because if you are not even accepting that you have Parkinson's disease, how would you improve on it? And I want to say a beautiful quote by Michael J. Fox on acceptance. He said, acceptance doesn't mean resignation. While some people think that if they accept the diagnosis, then they can't do anything about it. It only means understanding that something is what is, and there's got to be a way through it. So once you accept, then you can move on and you can look ways to improve your condition. So there's a lot of power in acceptance, and I call it power of acceptance. And here the journey begins into recovery. Now, when you look into the choices, there are so many choices, but if you just go see a doctor and he gives you a pill and you don't do anything from your own side to improve your condition, then things doesn't improve on its own. Then the disease progresses, you keep increasing the medication, and there is no change in the graph of the disease, which is a progressive neurodegenerative disorder in which the disease gradually gets worse as the time goes by. To change this graph, you have to take some steps to improve. And at the same time, I would suggest you that once you have accepted and then you go on this journey and you look around, there are a lot of choices to make. As Michael J. Fox again gave a beautiful quote that I don't have a choice whether or not I have Parkinson's disease or not. But surrounding one non-choice, there are millions of other choices I can make. So once you have accepted the diagnosis, and a diagnosis acceptance needs a lot of courage, because when you don't accept, you're hiding from people, from your relatives, from your friends, and then you can't ask for any help because you have not even told them that you have got this problem. When you are inclusive with your diagnosis, with accepting the diagnosis, you can take help from various resources and you can move on. Now I will talk about the second concept, which is stress, and how the stress plays a role in Parkinson's disease. There are studies in which they have found that stress is implicated in Parkinson's disease. I have seen patients with Parkinson's disease that something major emotional went in their life and followed by Parkinsonian symptoms. And It can be death of a relative, financial loss, stress with studies or career planning, or it could be anything. Sometimes things look trivial, but for that person it might be a big thing. So stress can precipitate symptoms of Parkinson's disease. The second important thing which almost every Parkinson's patient has realized is that when they are anxious, when they are emotionally stressed, they have anxiety, the Parkinson's symptoms like tremor, shakes, dyskinesia, they get worse. Even their balance can be worse and they feel more wobbly on their feet. So it means that the stress, anxiety, all these play an important role in Parkinson's disease symptoms and also in their recovery. Another important research finding is that the cortisol levels, which is a stress hormone, are high in Parkinson's patients as compared to controls. And it's found in studies that when Parkinson's patients take levodopa, which comes in the form of a tablet, to replenish their dopamine reserve, the cortisol level goes down. So that means there is a relation between taking dopamine and decreasing the stress hormone. So stress should be managed well in Parkinson's, and decreasing the stress can improve your symptoms. So friends, in the next video, we will talk about what is this stress and how to control this stress. And there is a powerful technique which is called as meditation or mindfulness, which can be used to decrease the stress, to improve your symptoms, and to come to that restful state in your own self where there is no stress. Thank you.